Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. Family matters when it comes to hospice. A lot of people have misconceptions about hospice, so we want to dispel some of those misconceptions and also talk about why family does matter when it comes to hospice. So here to talk about that is Danielle Greer, DO, and she is with Radiant Hospice. Danielle, how are you doing today?
Pretty good, thank you.
I'm glad you're here because we wanted to talk about hospice in general and also specifically Radiant Hospice because, we talk about family matters. That definitely is true when it comes to Radiant Hospice. Tell us about Radiant Hospice, sort of the background and philosophy of Radiant.
So we are a family-owned and operated hospice organization. We were founded in February of 2019, and if you recall, right after that, the world kind of changed. Since opening in February of 2019 with 0 patients, we've been fortunate to help over 700 patients and families transition to end-of-life care. And that's something that we're really proud of.
Yeah, that's a lot of growth. And so it's family-owned.
Yes.
Why does that matter?
We're not a corporate entity. Our owner is a social worker who started a hospice organization in Arizona. And then she branched out and opened an organization here. She worked in hospice, learned the ropes, and opened her own hospices. And she still focuses on patient first. Do what's right for the patient. That's our main focus.
Well, and also family matters when it comes to hospice because you treat your patients like family. They really get that feeling.
Absolutely. That's what I encourage all of our staff is, if we treat patients the way that we would want our families to be treated, then we're doing things right.
That's great. I want to dive a little further into your role, but before we do that, like I said earlier, there's some misconceptions about hospice, how people view hospice, end-of-life care, et cetera. So I wanted you, if you could, to kind of talk about just generally what hospice is and what it's not.
Yeah, so hospice is a Medicare benefit, which is also a benefit of all other insurance companies. If a patient has a prognosis of 6 months or less, if their disease follows a natural course, they qualify for hospice. And it is not about death and dying. It is about life and living. It is about making sure patients are comfortable and families are educated on what's coming, what they can expect, and trying to make that process as painless and as peaceful and as beautiful as it can be. Everyone is going to pass away at one point, and we believe that everyone deserves to be on hospice when they pass.
Yeah, and I've heard of people actually graduating off of hospice, so
Absolutely.
It doesn't necessarily, like you said, it's not about death and dying, it's about life and living.
Absolutely. We actually recently had a patient who had a surgical procedure, had some complications from the surgery, including anesthesia complications, and he became very, very confused and stopped eating. The family just wanted to get him home. We got him home, and once he was back in his familiar surroundings, he improved, and we got physical therapy in, and he graduated off of hospice.
That's amazing to hear.
Yeah.
That's fantastic.
Yeah.
Let's dive a little bit deeper into your role. You are, it's a unique situation with your hospice company because of you. Tell us about your role there.
So I'm internal medicine, board trained and certified. I worked as a hospitalist, which is somebody who takes care of inpatients in the hospital for almost 20 years. I started with Radiant on day one. I was actually employee number 2, hired to work with Radiant Hospice. Initially, it was a very part-time position, especially since we didn't have patients at first. But as we grew as an organization, my role with organization has also grown. I was initially the associate medical director, and then I moved into the medical director position. We hired another physician to be a secondary backup physician for us. Over the last couple of years, I actually moved into a clinical director position, and then in January of this year, I moved into the chief administrative officer position as well. I am very actively involved in the care of our patients. I think a lot of larger corporate hospices are similar to how it is when I first started. The physicians have hospice as kind of a side job. They have other jobs. This is my job. This is what I do. And so I know the patients, I know the families, that can say, oh, so-and-so looks like they have a urinary tract infection. And I can be like, oh, we treated them a couple months ago for urinary tract infection. Why don't we go ahead and do this? Because they're my patients. And so I know them.
Is it common for hospice companies to have someone of your background and credentials on staff?
Well, all hospices are required to have a medical director, but it's usually somebody who works other positions. It's not typical to have them be a full-time with hospice.
Got it. And I know you also have the RN model of care, so talk to us about that.
Yeah, so being family owned and operated, we are more of a boutique style hospice, and so we focused on having our case managers, our RN case managers, have a smaller caseload. Some hospices have their RN case managers have caseloads of 20 to 25 patients, and basically they're managing other nurses taking care of those patients. Our model is our RN case managers have 12 to 15 patients, and they are doing the majority of those visits for those patients themselves. We do have some help if they need it, but so that they're not feeling overwhelmed and,
can't handle it.
Yeah, drawn too thin.
Yeah.
But they get to spend time with those patients and the families, and they get to know, what is going on with those patients and families, and kind of what to expect as the disease progresses, and they can educate the families, and it's just much more of, like we talked about, more of like how a family would like to be treated. The nurses often are invited to the memorial services, and
that says a lot.
Yeah.
That's great. You guys have a volunteer program, so tell us about that.
Yeah, we have an amazing volunteer program we're really proud of. We have a veteran program. We have veteran volunteers that can go and do a veteran pinning for veterans, and that is so beautiful. Oftentimes the families appreciate that, sometimes more than the patients themselves, but sometimes it's the patients too that are just so proud. We're very proud of our country and respect our veterans very much, and so that's something that we are really proud of. We also do those veteran pinnings for people who are not even on our service. If we have a facility where maybe we do have a patient that we're providing that for, we ask the facility if there's any other veterans that would benefit from that, and so we've done pinnings for patients who are not even on our service.
Oh, that's great.
Yeah, and then our volunteer program also has art therapist and pet therapy. So they take a service animal to go and visit patients and, bring joy.
That's awesome.
Yeah.
And I know pets are very important for that. So.
Yeah, and that also benefits other residents of facilities because the pet gets to come in and say hello to everyone.
Yeah, for sure. Everyone benefits.
Yeah.
So amazing stuff. Radiant, it does such a great job. Information for Radiant Hospice is on screen. Website and phone numbers. You can give them a call or visit their website for more information if you're watching on video. If you're listening on your favorite podcast channel, obviously you can't see it, but it's in the caption information, so you can get their information there. Thank you very much, Danielle, for coming and sharing about why family matters when it comes to hospice, about Radiant Hospice.
Thank you so much for having me.
My pleasure.